All drug overdose deaths have spiked across the country. The latest CDC numbers show almost 100,000 deaths just in 2020, the latest full year of data available. That's a 31% increase over 2019. And last night we told you about solutions saving lives in states seeing a decrease in deaths from synthetic opioids like fentanyl. But what about Texas, where the death count is still going up? KXAN investigator Arezow found some researchers say that we need to expand services to save lives.
The crackdown on fentanyl in Texas is now law.
Last summer, Governor Greg Abbott signed a new law increasing penalties for making or selling fentanyl. It can lead to life in prison. And it came after he deployed thousands of Texas Department of Public Safety troopers and Texas National Guard members to the border to help stop the smuggling of fentanyl.
I think as long as we're focused on supply reduction, reducing opioid prescribing, reducing the available supply of illegal drugs, illegal fentanyl, that we're missing the real solutions.
Dr. Lucas Hill with UT's College of Pharmacy has researched expanding naloxone distribution at pharmacies in Texas. Any pharmacist wanting to distribute naloxone can do it through a standing order, which has to be signed by a physician. But it's an opt-in process, which can limit access.
And we need to provide harm reduction strategies like naloxone, like sterile syringe access, like fentanyl test strips so that people can identify potent drugs in their supply. We need to provide those strategies to people who are not interested in treatment or not ready for it yet.
Dr. Hill says he hoped a bill would have passed to legalize syringe exchange programs in large counties, but it failed to pass last legislative session.
Certainly looking at the evidence base supporting it, showing that it does not encourage drug use, that it does not increase criminal activity, and that it actually protects first responders by decreasing their risk of having a needle stick from a used syringe.
In New York, the first overdose prevention centers where people can use street drugs under medical supervision are proving to work. The health department says the centers have already saved lives and stopped 59 overdoses in the first few weeks of operation. Now, Dr. Hill says we're seeing for the first time federal funding specifically for harm reduction solutions. He says for Texas to be competitive, we need the basic infrastructure like syringe service programs to be legalized. Arezow, KXAN investigates.
And Arezow mentioned the new law increasing penalties for making or selling fentanyl, which went into effect last year. DPS data obtained by KXAN investigators shows that from just September to January, there were nearly 600 arrests by all law enforcement agencies statewide for the manufacture or delivery of fentanyl.